Hi everyone, welcome to our Unit 3 discussion here in ST125 Surgical Instrumentation. So let's go ahead and get started. These are your assignments for this week, just a reminder. Not a whole lot going on, but except for this building a mock instrument pan is a little bit more point-wise, so make sure you get that in for sure. That does weigh pretty heavily on your grade, those types of assignments. You guys are doing really well with your discussion posts. The only suggestion I would make is to make sure you don't forget to go back and respond to a peer. That's typically where I think most students get their points taken off. And I mean, over time, that's going to add up. That's a lot of points if you don't do that every week. So keep that in mind moving forward. And, I try to make notes on all those assignments so you can go back and check those. All right, so this week our objectives are basically talking about care and handling of surgical instruments, proper disassembly, what types of equipment and machinery you can use to clean these instruments as well, and those safety measures. So let's start with the decontamination area. So we'll go a lot more in depth in this in ST120. But the gist of this is the decontamination area is the dirty area of sterile processing department. So that means every dirty supply, even if it got opened and didn't get used on a patient, it still has to go to this area to be reprocessed. This is the dirty side. Okay, remember we keep clean and dirty separate, very important. So anything that was opened or used during surgery or maybe even in the ER or whatever will go here to be reprocessed. Okay, so part of that process is over here in this little 3-sink area. Actually, I think they're even kind of labeled here on the floor. I just noticed that. But in each decontam area, there should be a 3-sink process because you have to initially start scrubbing it with special brushes. The middle sink is a rinse, and the third sink is a rinse with different water type and cleaner. That way you can put it in something like this ultrasonic, which is what this picture here is, an ultrasonic cleaner, which uses cavitation, like a high frequency energy to shake it up. And as the bubbles are, in the fluid, it actually will help pull off some of the dirt, debris, blood, bacteria, whatever. And then it can be put through the washer decontaminator. So the whole purpose of this is to get rid of the gross debris like blood or tissue, anything like that, so it can be safe to handle on the other side of that wall, on the clean side of the sterile processing department, because that's where you're going to really get a good look at those instruments and make sure that they're safe for use, that there's nothing wrong with them, they're functional, and then we can restring them or put them back in trays or put them in peel packs and put them back through the sterilizer. So this part of the decontam area isn't sterilizing the items, okay? It's only making them clean because it's not killing spores, but it is still making them safe to handle for humans on the other side to reprocess them, to re-sterilize them, okay? So part of that process really starts at what we call the point of use. So as you're working as a surg tech, if that's the role you're going to take, the route, you need to remember that when you are in surgery, you clean that instrument as soon as the surgeon hands it back to you. That's cleaning at the point of use. So if the surgeon, cut through some really bloody tissue and gave you those Metzenbaum scissors back, the first thing you should do is wipe it off. I put towels down on my Mayo stand, okay, and leave a little corner of one of those blue towels. Sometimes the Mayo covers come with the towel, so it's free, okay? You can have that towel available to you on the corner. I just do a quick little wipe, okay? Make sure that there's nothing in the box lock, because if blood and debris, tissue gets gunked up in those instruments, they will not be effective for that surgeon. The scissors won't cut. They'll be really hard to open. For example, have you ever used your kitchen scissors to cut, let's say, popsicle tops, okay? Those freeze pops, otter pops, whatever you call them, and you put them back in the drawer. My kids do this. It drives me insane. after a while, they become very hard to use, right? It's the same concept. Blood gets very sticky and will gunk up instruments very quickly. So make sure you're cleaning them. Any instrument, as soon as the surgeon hands it back to you, give it a quick little wipe, okay? You can soak your instruments in sterile water, but not saline. So if that's something your facility does, make sure it is sterile water, not saline. Saline will pit the instrument and cause it to rust. You don't want to do that for sure. Now, a quick little wipe with some saline really shouldn't hurt it, over time. It's just the soaking it you don't want to do. So another thing, and some facilities do different things. They have different policies on how they want their instruments cared for during and after the case. So you just kind of go with what they say, but a lot of facilities do require you at the end of your case to spray it with something called an enzymatic cleaner. A lot of different brands. This is just one I pulled up so you could see it, just to give you an idea. It's a foam spray that uses an enzyme. An enzyme is something that helps break something down very quickly, like fats or bacteria, tissue. Okay, that's what an enzyme does. Our body has natural enzymes, but that's beside the point. So it says prevent surgical soils from drying during the transport to the final cleaning decontamination area. So, they list a lot of options. You could have this in the vet clinic, dental offices, labor and delivery. So, anytime you're going to have those types of instruments that need cleaned, sent back to decontamination. Can be used, in ortho, GI, complex surgical soils, things that get really gross and dirty, bloody, lots of tissue. So if something dries on those instruments, it becomes very hard for the decontamination to clean those off. Okay, like cleaning your dishes. If you let it soak for a little bit, right, it's a little bit easier to scrub off. Same concept. So it really makes it easier for decontamination to clean, makes it safer for the patient. It ensures that it's more likely you're going to get all the gross debris and bacteria off those instruments. And it really promotes the longevity of the instrument, keeping those instruments in top shape. So these are the things you definitely should be looking for and doing before you send items to decontamination. Cleaning at the point of use, make sure those instruments are disassembled if they can be, and we'll go over that here in a few. And then this can be tricky. Place all the instruments back in the tray that they came in. That's going to make it easier for your sterile processing person getting those back in the tray to be re-sterilized. It can be tricky because sometimes you have a lot of trays, 6, 7 trays, depending on the case. Come up with a system. Sometimes they're marked, just depends on your facility. And then again, spray with that enzymatic cleaner right before you send it downstairs. So obviously, very end of the case, patient is out of the room and you don't need those instruments again. Okay. So here are some examples of disassembling instruments and why it is so important to pay attention to what instruments can be or need to be disassembled. For example, this was a hot topic, well, it still is, but it was a pretty hot topic several years ago, but using the Kerrison rongeur. So if you haven't learned what a Kerrison rongeur is, this is the kind of disassembled version. This little thing slides over. It is like a pistol grip is what they call this style. Pistol grip instrument that removes chunks of dense tissue like part of the vertebrae, like we call it the lamina. So if we're doing back surgery and we need to expose the spinal cord, we take little pieces and chunks of bone off that vertebrae to expose that spinal cord. So in the little jaw here, you squeeze the handle, and it just piece by piece takes little pieces of bone away. So in this, where the top and the bottom part meet is a groove. Okay, you can kind of see in these other pictures that blood and debris, bone tissue can easily get stuck in. So several years ago, maybe close to 10, a lot of Kerrisons were not easy to take apart. they could be taken apart, but they were not as easy to take apart. So a lot of facilities were not taking them apart. Okay. And this is what was happening. I mean, look, this is disgusting. So even after going through decontamination, being, scrubbed properly with brushes, putting through the sterilizer, this was still what was left in between this top and bottom rail, which is gross. And it was being used on patient after patient. So you can imagine that the incidences of surgical site infections were high. I mean, if patients knew, I mean, it's just gross. So take very good care of disassembling instruments. So now this is kind of a newer version where it's got this easy release button, and then you have to brush this inside part to get that gunk out, which is gross. So that is one example. Here are some others. So sometimes as you're learning, it's kind of hard to know what truly comes apart and what doesn't. You can always check your IFUs or ask. You'll learn over time what should be taken apart, because if instruments do not get taken apart, and they should be, like I just showed you with that kerosene, and they're being resent, reprocessed, what doesn't get taken apart isn't getting sterilized. Where those items meet the sterilant, no matter what it is, steam, ETO, it doesn't matter, is not getting in those spots that are not taken apart and should be. So that is running the risk of surgical site infections. So here are a couple examples. So this is a metal Yankauer suction tip. A lot of my previous students, I think, didn't really know this should be taken apart, because we most often use the plastic disposable Yankauer, and it doesn't come apart. So when they had something like this on a practice test, the question was something like, which of these instruments should be disassembled for decontamination or something along those lines. And one of the options was Yankauer, and the others didn't make sense either. So my students really struggled with that question. But it is this, because if you look closely, the very tip of this screws off. It has a little bit of like a suction control, like little holes here where you suction through for this option, but it does come apart. It is a small piece, but it has to be unscrewed before you can decontaminate it and re-sterilize it. So I like to point that one out. Not every facility will use it. Some just use the plastic and don't worry about it, but some still use it. This one over here in the right top box is called the Kleppinger bipolar forceps. So it's used laparoscopically. So a lot of laparoscopic instruments, I just gave you this as an example, do come apart because the handles come apart from the shaft of the instrument. Okay, so that either they usually they screw on or something similar, a little notch that they sit in, but the Kleppinger typically is 3 to 4 pieces. Ours is 4 because it has a small little rubber piece that goes over like the port part. Okay, so every single piece has to come apart. There's usually a button here somewhere on the side that releases it so you can unpop it. So same concept with other laparoscopic instruments. So these bottom two are both cystoscopes. I just wanted to show you an up close version of what this looks like, because it's kind of hard to see. But cystoscopes, a lot of different types of scopes, have a lot of parts that come apart. It's a lot to say. But the reason is because you have what's called a bridge, which is this middle part here, where you've got like working channels or ports that you can slide wires into. So that comes apart. The scope itself slides in and out. So obviously the scope has to be processed separately. Sometimes you have this little, right here, you can kind of see it, light post or light cord adapter that unscrews depending on the system you use and the light cord, whether or not you attach it. So here's your bridge, locking mechanism for the sheath. So these cystoscopes have an outer sheath and an inner obturator. So obturators have to be removed from the outer sheath for it to be processed. So cystoscopes, for sure, ureteroscopes, hysteroscopes, all of them have the same concept. They have to be broken apart in separated sheath from obturator. Okay, so I have this good little video here on decontamination and what to look for, how to, separate this tray for decontamination. So I really like this little video.
What's going on, guys? Welcome back to WDYDCSP. What do you do as a central sterile processor? Guys, today we're going back to decontamination, and we're talking receiving trays from our customers. All right, guys, so if you have a good relationship with your customers, this is what you should be seeing coming into decontamination after use. Okay? Instruments back on the stringer, all the instruments that belong in the basket in the basket, preferably if they are really taking care of you, the sharps are separated from the regular instruments, but because they're back on a stringer, this is showing care for safety, because now you don't have to reach in the basket to get these sharps. They're all on the stringer, very easily accessible, right? Now, again, as you can see, this instrument set, it looks very clean, which it should look as clean as possible. There's going to be some soil on there, but you should see either a pre-treatment spray or a moist towel over the set to keep the instruments moist as they're being transported over to decon. Now, this instrument set is in its container, so in decon what we want to do is we want to separate the basket from the container. Hey, don't forget to show the container some love, guys. The container also is a medical device, so you want to go ahead and clean this and rinse it, and then place it in the appropriate processing step afterwards, whether it's a manual clean, a automated clean, whichever one it is. If it's a manual clean, then this requires a rinse, a soak, a wipe down, a final rinse, dried and sent through the window. If it's an automated process, then we're manually prepping it, we're rinsing it off very well, removing all the gross soils that we can possibly see, give it another rinse, and then place it into, because we're rinsing out any pre-treatment that's in there, removing all our gross soils. We may use a sponge of some sort to wipe out the interior and exterior of the basket. Make sure to remove any consumables such as lot sticker cards. If the count sheet is hanging on the handles, or any tags or anything of that nature. Then you're going to place this either in your washer disinfector or preferably your cart washer, right, to clean your containers, right? So you're going to place that in there. But we're talking about our instrument set. So this is what our instrument set should look like. And depending on your flow should always be the same from dirty to clean. Now, whether that's left to right or right to left, I mean, it depends on your facility, right? But you have your 3-sink setup. And however you're going to set that up as well, it's nice to have an adjacent workstation, right? Because your first step in decontamination is to sort your instrumentation set, right? This is not the way that this can be rinsed, soaked, and then you're going to try and take this apart to clean it. It can't go into the ultrasound like this. It can't go into the washer like this, guys. It has to be sorted. It has to be broken down. So if you have a workstation, that'd be great. So the first thing you want to do is you want to remove your stringer. See how nice that is to remove all your instruments, and then everything else in the bottom is visual. Now, in decontamination, you will see, okay, you're going to look in your basket. Well, here's 2 consumables in here. You want to get rid of those, throw them in the trash, and then everything else you want to get out of here. Now, you want to be visual in there and look for those sharps. If you can't see those sharps, guys, even with general utility gloves, please be careful reaching in there, because those sharps will penetrate these gloves very easily, right? So grab the things out of here that you can see that's big. Forceps, suctions, things of that nature. You want to pull all that out, right? And then work your way to the smaller items that you can't see very well, right? Okay, take all your items out of here. And as you can see, I see another retractor in here. and I see 2 skin hooks, and I'm going to use the retractor to get those skin hooks out of there, right? And you're going to place them onto the side, because again, now remember your basket is a medical device as well, so you want to rinse that off very well. Any consumables that are in there, get rid of them. If they left a liner in there, if you're using liners, get rid of the liners, any indicators, any tip protectors, blah, blah, blah. Rinse this off very well to remove any chemistry, any gross soils. And this, again, if it has feet, the feet should be on there, right? Now this basket, my flow is going from dirty to clean, okay, goes to my to the cleaner area, right? Now you don't want to soak this yet, right, in your soak sink. You want to have this readily available, because what you're going to do is you're going to rinse all your items off to remove all the gross soils. Place your suctions off to the side, because your suctions need to be flushed and brushed. And then you're going to place everything back into the basket to prep it to the next step. If that's manual preparation, then your items go back in the basket organized, right? Organized in a manner that will facilitate the best cleaning in the mechanical action that you're going to use, whether that be the ultrasonic, whether that be the washer disinfector, or both, okay? Remember, in the ultrasonic, items should not be cluttered in there, right? Shouldn't be no clutter in there. You see how hard it is to pick up items, right? With these utility gloves. But you want to grab all your items and try not to stack them as much as possible. Okay, you want them flat in the bottom of this container. Your stringer, guys, your stringer, okay? Your sharps place over to the side there. Okay, your stringer now is you want to take your instruments out, place your stringer in the bottom, and then for your instrumentation, this is what I suggest for safety. Okay, and I'm not going to go through this whole process, but I'm going to show you what it looks like when we get over to the prep and pack side. All your instrumentation should be open to the fullest extent that it can open, right? For anything that's sharp, okay, I know standing straight up is best practice, but for sharp safeties of your peer, I recommend that you open your instruments up to the fullest extent and lay them curved side down into the basket, okay? So if people are digging in there, they're not going directly into a sharp, right? They can scoop from the back. They'll see that in the bottom of their baskets. Anything that's sharp, that's including perforating towel clips and all of your scissors, right? Take all of your scissors and open them up, you know, at the fullest extent, curve side down, lay them in the bottom of your basket. Now, when you're organizing your instruments to place them in the basket, okay, it's best, you don't have to organize them by like instruments, but you do want to organize them by length, right? It's easier to open them up and stand them straight up according to length. So you want to grab a group of instruments after you fully rinse this to remove all the gross soil, and then you're going to stand them up in your tray, preferably straight up like so. Okay? This is how you want to organize your instruments, right? And you want to do that for all the instruments that you can do so without it overlapping the instruments or too far above the instrument tray, right? Okay, so you want to do this in a nice, organized fashion, just like this. And sometimes it can be a little difficult, but you want to go ahead and organize that just like that for all the instruments that you can do that with. And it's easier to do it with instruments that are of the same length. Okay, when you get to instruments that are too long, guys, okay, such as these, okay, your instrument, especially in this small basket, these instruments aren't going to fit in the basket standing straight up. So you have to open them up to the best you possibly can and lay them flat on the bottom of the tray in the open position. You will get the same cleaning action, guys. It's not going to be anything different. Remember, your irrigation or your, your irrigation and your, not your cannulation, because not your cavitation, because cavitation is in the ultrasonic. Your impingement is from top to bottom, not side to side. So you're going to get the same cleaning action. After you have flushed and brushed all of your suctions, you want to place them on a angle where you can get drainage. So you want to go ahead and angle them in your basket so you get good drainage of your suctions when you place them through your next step. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Until next time, peace.
I like that video. It kind of shows you the steps that they're going to go through and decontam with each tray. Now, I want to point out that that one yank hour that he did have did not look like it had a tip that unscrewed from the end of it. So that is a possibility, but a lot of yank hours do have that tip. So again, it's just one of those things. Each facility might be a little bit different. So always check those types of things. So that's kind of wraps up our discussion for this week. If you have any questions, please don't hesitate to reach out. You guys are doing a great job. So keep up the good work. Bye.